Hello everyone, welcome back to our channel, and in today's video I'm going to have a chat with you about spironolactone for acne. This is a drug that recently has become very popular and very much kind of probably driven by a few trends on TikTok, and so I thought I'd do this video to just kind of explain what it is, what it can actually do, what it can't do, so that you can just have a little bit more factual information about it. So before we get started, if you're new to this channel, welcome. Please don't forget to subscribe and hit the notification bell. If you are a returning viewer, welcome back and thank you for your support. Let's start off with spironolactone. What is it? Well, this is a medication that's actually been around for quite some time, and it's largely a diuretic, which means it helps kind of increase urine output, and its licensed use is for treating high blood pressure. It's a very useful, important medication. It's been around for a long time, and it's largely used as an oral medication for that purpose. So what's that got to do with acne, I hear you ask? Well, one of the things it was found to do is it also blocks androgens, and these hormones, androgens, are like progesterone, testosterone, and we know that androgens can drive acne, or what's known as hormonal acne, and they do this in a number of ways. One of them is they increase oil production, which is a key driver for acne breakouts, and so by regulating oil production, this reduces breakouts due to hormone-related or androgen-related acne. So that all sounds great so far, and this is for this reason it is sometimes used off license in order to treat acne. Now here's the rub. When it is used, it really is only going to help with acne that is hormone mediated. So if your acne is not due to hormones, if the main cause is kind of other triggers, other reasons, which is most acne, then it's not going to help at all. It's also not going to do anything for existing acne scarring, for hyperpigmentation, post-acne redness, none of that stuff. So that's something you will need other treatments for that, even if the spironolactone can help. The other thing that spironolactone is, when it is used off license, it's generally reserved for women. It is not doesn't tend to be used for men because it can have feminizing effects, because it also can block androgens like testosterone, and so it's very rarely used in male acne, and it tends to be used generally, if it is used ever, in women. The main way it is used, or has been, for acne, and this is again, it's not licensed for this, but it is, lots of research shows it can work for hormonal acne. The main way it has been used is as an oral medication, and the medication will then over time kind of block excess androgens and reduce hormone-related acne. Nothing works overnight. I hope you know this if you've been around this channel long enough. It's going to take at least 4 to 6 weeks as a bare minimum to start noticing anything, and even then, most effects won't be really fully kind of realized before the 3 to 6 month mark. So that's one thing to realize. The other is that initially it can cause a flare-up of acne. And so that, you may be taking it, and like a lot of medications, it can increase the acne initially, and that's something else to be aware of. The other thing to be aware of if you're taking spironolactone, definitely orally, is there may be side effects. So like I said, remember, it's a blood pressure medication. It works by basically making you pee a bit more, so it's a diuretic, and so you may notice increased urine output. As a result, that can lead to dehydration, it can lead to dizziness, it can lead to kind of not generally feeling yourself. It can also affect potassium levels. So there's not something to be taking orally if you haven't had baseline blood tests by your doctor to make sure that your kidneys are fine, to make sure your electrolytes are fine. And then, of course, because it blocks androgens, there can be some secondary side effects. So if you're, maybe a little bit of a disturbance in your menstrual cycle, that sort of thing. So be aware of the full picture. Increasingly, spironolactone is being used topically as a cream, again off license, and we do this for suitable patients, and that helps with acne, but with hormone-related acne again. And sometimes it can be compounded with other things to take care of things like scarring and hyperpigmentation. And it does reduce some of those side effects like the blood pressure problems or dizziness and increased urine, but they can still happen. And so even if you're fit and well and you have hormone-related acne, it's not for everyone. Like I mentioned, it's most effective in women with fewer side effects, but even then, pregnant or breastfeeding women or ones planning to be pregnant should avoid taking it because we don't have any studies that it's safe for this use in these groups. And also you should, if you're on this drug, make sure that you are receiving appropriate monitoring. It goes without saying it should be prescribed only by a doctor and that they should be monitoring you and making sure that you're getting on with it and not experiencing any side effects. And if you are, they may adjust the dose or completely stop it. And just to recap, spironolactone, it can be effective in hormone-related acne in the right people, and when used appropriately, it's not going to do anything for your scarring or your hyperpigmentation. You'll need other stuff for that, but as part of a comprehensive plan, it can be effective. I'm going to leave an article that I wrote that goes into more detail about spironolactone as an acne treatment, and I hope that you found this video useful. If you liked it, don't forget to give it a thumbs up and please subscribe and hit the notification bell if you haven't already done so. Until next time, stay beautiful.